So it's been a little while since we talked about testing. Figured it was time for an update, and the criteria for who's eligible to be tested in Manitoba have changed. So right now, anyone who has symptoms consistent with COVID can be tested. So it used to be you had to be a healthcare worker or live with a healthcare worker or be an essential worker or have traveled, something like that. But now any Manitoban who has symptoms, in fact anyone living in Manitoba, whether you're officially a resident or not, and has symptoms, can go to a testing site to be tested. Now the symptoms that I'm talking about, the most important ones, are cough, fever, nausea, vomiting, or diarrhea for at least 24 hours, a sore throat, and shortness of breath or any sort of breathing difficulties. So any of those, automatically you'd be eligible to be tested. On top of that, there are some other symptoms that are not as common with COVID, but if you had more than one of them, we'd start to worry a little bit, and so it's worth testing. So that's things like muscle aches that you can't explain through physical activity, a new headache that's not something typical for you, fatigue that's new onset, weird rash, particularly if it's on your fingers or your toes, some redness on your eye that's something you can't quite explain, or a runny nose, but again, not by itself, especially because right now it's allergy season, so a runny nose alone wouldn't necessarily be enough. But if you have more than one of those, then that's a time that's good to go and get tested and make sure that it's not COVID. So you've probably heard that in some jurisdictions they're doing asymptomatic testing, and I am in the next video going to talk about when Manitoba is considering doing asymptomatic testing and why. But the short version of why I'm telling you to stick with symptoms only is that the test isn't very good for people without symptoms. So there's something called sensitivity. That means how well a test actually picks up what it's trying to pick up. So, of 100 people who take this test who actually had the infection, how many of them will test positive? That's the sensitivity. So how many times do we miss people who actually have the infection? That goes up when the sensitivity is worse. So this test is sort of okay for sensitivity, but we know it's going to miss some true infections. And the less symptoms you have, the less likely you are to get that positive test. And it hasn't really been studied very much in people without symptoms. So when you have symptoms, it can be very helpful to guide management, because for sure if you get a positive test, that's pretty reliable. It's pretty specific to COVID, so if you have symptoms, you get a positive test, the picture's pretty clear. If you have symptoms and you get a negative test, then we're not quite as sure what to do with that information. You probably don't have COVID, but we're not going to say 100% that you don't. So we are recommending that if you have symptoms and you test negative, you should still keep yourself isolated until you've had no symptoms for 24 hours. And that's just in case we were wrong about that, and that it is COVID, or even if it's not COVID, we don't really want any respiratory viruses circulating in the community because it muddies the water and makes it harder for us to know what's actually going on. If you don't have symptoms, then it makes it even harder to interpret. So a negative test in someone who doesn't have symptoms doesn't bring me to any new information or new management than what I thought before they had the test. So I thought that they were low risk and probably didn't have the infection before having the test done. And because it's even less sensitive in someone without symptoms, afterwards, I sort of think the same thing. Well, they probably don't have COVID, but I don't know that for sure. If they had a positive test, that's still pretty reliable, and so that would be helpful to change management. Although even then, we don't really know how infectious somebody without symptoms is, so it's still tricky to figure out what to do with that person. So overall, it's not a great test for screening. Screening is when we test someone who doesn't have symptoms to try to pick up disease early on. So if you think about, screening with Pap tests for cervical cancer, for example, we want to catch it before the person has symptoms so that we can treat it early. This isn't a very good screening test for COVID because it's not particularly reliable to pick it up. But in the next video, I am going to talk about some of the circumstances where you might see testing happening in people without symptoms. But what you need to know overall is the list of symptoms that I gave you, and please go for testing if you do have them, because we want to make sure that we are managing things appropriately and preventing further spread.